अस्सलामुअलैकुम दोस्तों, वेलकम टू माय यूट्यूब चैनल एडल्ट हेल्थ नर्सिंग। जैसे कि आपको पता है, हम ऑर्थोपेडिक नर्सिंग पढ़े थे, जिसके 2 पार्ट्स हमने अपलोड कर चुके हैं अपने यूट्यूब चैनल पे। ये हमारा पार्ट 3 जो कि ऑर्थोपेडिक नर्सिंग है, एप्लीकेशन ऑफ स्किन इंट्रैक्शंस टू द लेग। तो कौन कौन सी है, तो उसको हम आगे पढ़ने जा रहे हैं। Responsibility for initial application: the physician is typically responsible for the initial application of traction and waits while the adjustment or removal to perform ablutions functions. Physiotherapy of skeleton tractions weights will be based on the doctor's chartered plan. Amputation is a removal of the body extremity by trauma, prolonged concentrations, or surgery. As a surgical measure, it is used to control pain or disease process in the affected limb, such as malignancy or gangrene. In some cases, it is carried out and individually has a preventative surgery for such problems. ये देखो, काट के वो हिस्सा काट दिया जाता है जो खराब हो जाता है। टाइप्स ऑफ एम्पुटेशंस: leg amputations, arm amputations, other amputations. Complication of musculoskeletal problems: depressions, joint damage, limited mobility. Assessing musculoskeletal status: wash hands, provide an explanation to client of the assessment procedures, assist the client to the comfortable position, use pillows or flood blankets to support painful body parts, provide assistance with disrobing as needed, adjust room temperature for client comfort, provide clear instructions to client assuming a certain body position or performing a certain body movement, inform client before touching or moving a painful body part, assist skeletal muscles and joints in a cephalocoidal proximal to distal manner, upper to lower. Examine non-affected body parts. Before examining affected ones, avoid unnecessary or excessive manipulations of the painful body parts. If the client verbalizes pain, stop the exaggerating motions. If needed, assist client in decreasing after the physical examination is completed. Soft tissue injury. A soft tissue injury (STI) is the damage of muscles, ligaments, and tendons throughout the body. Common soft tissue injuries usually occur from a sprain, strain, or one of below, resulting in a contusion or overuse of a particular part of the body. Soft tissue injuries can result in pain, swelling, bruising, and loss of functions. Fracture. A break in a bone or cartilage throughout the usually a result of trauma or fracture can be the result of the acquired disease of the bone, such as osteoporosis or abnormal formation of bone, in conjunctival disease of the bone, such as osteogenesis imperfecta, brittle bone disease. Fracture are classified according to structure, character, and location. For example, green sticks fractures for radius. Piget's disease, a chronic disease of elderly people characterized by alternation of bone tissue, especially in the spine, skulls, and pelvis, sometimes causing severe pain. Osteogenesis deformans. Disease: osteogenesis deformans, excessive the bone destruction, unorganized bone formation and repair, and the second most common bone disorder in the US. The etiology is unknown. Usually affect the axial skeleton, vertebrae, skull, although the pelvis, tibia, femur are the other common sites of disease. Most persons are asymptomatic of diagnosis is accidentally. Gout, a medical condition usually characterized by the recurrent attacks of the acute inflammatory arthritis, a red tenders, hot swelling joint. Osteomyelitis is sometimes abbreviated to and derived from the Greek words. ये कुछ टर्म्स हैं जो कि आप खुद पढ़ सकते हैं. ओस्टियोपोरोसिस. तो दोस्तों इस वीडियो को रखते हैं यहीं तक. मिलते हैं नेक्स्ट पार्ट ऑफ दिस वीडियो. ये देखें, ये हाथ है, पैर में हो गया ना. ट्यूबरक्लोसिस रेफरेंसेस ये हैं. तो मिलते हैं अगले न्यू वीडियो में.